Now, Wisconsin is falling behind the rest of the nation in its vaccine rollout, but experts caution against reading too much into raw numbers and comparisons to other states. News 3 investigates. Naomi Coles explains what other states are doing and how it may or may not work here at home.
After blocking COVID measures in the legislature all year, this week, Wisconsin Republicans are ramping up criticism of the administration's vaccine rollout.
We still have 250,000 vaccines allotted to us that we haven't even asked for yet.
On Thursday, Governor Evers defended the state's plan when asked if he would change anything.
I think we're doing as best as we can considering the ramifications of the vaccines and the number of vaccines. We're moving in the right direction, but the bottom line is you have to have vaccine in order to vaccinate.
Important to understand, states don't buy vaccines themselves. The federal government does and then decides how much to send each state. And right now, every state is begging the federal government for more.
I think the biggest thing they want and need is doses.
Wisconsin's rollout does consistently rank near the slowest in the country. On Friday, it was 5th from the bottom, with a dose in the arm for almost 4.5% of every 100,000 people. But the differences between the lowest 16 states on the list is in the tenths of the percentage points. Topping the country, West Virginia and Alaska.
They are rural. They have a smaller number of providers.
West Virginia broke with every other state when they opted to forego the federal pharmacy program for vaccinating their long-term care population. Instead, they used their own local pharmacy partnerships.
So West Virginia is a good case study, but I don't know if that's necessarily transferable to other states.
Experts say top rollout states like Alaska and North and South Dakota have small populations and highly localized programs.
And that's not really replicable in larger states.
Unlike Wisconsin, other states that are ahead in the rollout opted to forego CDC guidance to only vaccinate healthcare workers in long-term care first, instead opening it up as well to broader populations all at once.
And so that kind of broadens the pool of people who are eligible. So you're going to find more arms to get shots in.
But in Florida, that also produced headline-grabbing images of seniors waiting overnight at times in long lines. Broadly speaking, experts say successful rollouts have a few key similarities.
A lot of states go with more of a large-scale clinic model where they can make appointments, they can schedule, they can round-the-clock vaccinate. I think states that are doing that are seeing, their percentages go up.
At the end of the day, it's been just over a month, and front-runners now may not be front-runners later.
We're kind of just around that first turn if this were a horse race. And some horses do come out of the gate a little fast. That does not guarantee they're going to be, crowned the winner.
And while Wisconsin is trying to broaden its eligible groups, they've also been told not to expect an increase in doses from the federal government for at least 3 to 4 more weeks. And we need 3 times our current weekly allotment to vaccinate 80% of our population by June.
The real key to this is the supply.
Health officials in the state and across the country are hopefully eyeing at least one upcoming vaccine candidate. That's from Johnson & Johnson. Ultimately, more vaccines on the market means more supply. For News 3 Investigates, I'm Naomi Coles.